Hi guys, how are you doing? It's Elaine Bintz, fitness coach, nutritionist, and massage therapist with Energy and Wellness. Today I'm doing a brief interview with Dr. Grant Burdeau. So we're going to ask him a few questions, get to know his business, and if you need a chiropractor in the Schererville, Indiana area, I hope you contact Dr. Grant. Dr. Grant?
Hi, this is Dr. Grant Burdeau. I'm the owner of One Body Chiropractic, located in Schererville, Indiana, and I'm a licensed chiropractor and acupuncturist.
Okay, so you're in Abstract.
Yes, so
Okay.
I'm located inside Abstract Bodyworks, located in Schererville, Indiana, off of Route 41, and I just occupy a space in the upstairs of that building.
Okay, so what kind of people can you help, Dr. Grant?
Really, the demographic that I see is across the board. So my youngest patient was 5 days old, and my oldest patient was somewhere in their mid 90s. And I see everybody in between for a variety of different reasons.
Okay, so what would be one of the reasons why someone would see a chiropractor?
Well, the big things that come to mind, people oftentimes come to see a chiropractor for issues with neck or back pain, but ultimately we can work on things that are much more widespread than that. So we work on, obviously, full spine pain or discomfort or dysfunction, but that also branches out into the extremities. So really any sort of functional movement issue is something that I would consider something that I would work on.
Okay, and as far as payment goes, what kind of payments do you accept?
So my practice is a cash-based practice, so unfortunately I do not go through insurance. All services are out of pocket. I do have people that utilize like HSA accounts, but other than that, it's cash, check, charge, or even electronic pay.
Okay. So then, if it's their first time, say someone's never worked with a chiropractor. So as a massage therapist, I get this question a lot. If they're going to see a chiropractor for the first time, what can they expect in a first visit?
Well, the initial visit, usually we will come in, we will do a little assessment of what's going on, and that includes basically the chief complaints of why you're visiting. After that, we'll go through a little bit of an exam, and I like to personally go through a full body exam. So despite whether you may be having pain in one area or another, I like a well-rounded approach, because sometimes we start having problems in one spot because you're having dysfunctions in another. So following that exam, we'll do a little bit of treatment, chiropractic adjustments, some body work as far as stretching or mobilizations, and then after that, we retest the initial exam areas so that we can revisit the spots that may have been more of a problem and see if there's progress being made. Ideally, in that situation, then we formulate a couple rehabilitative stretches or exercises that can be taken home and used over the next week or so before our next evaluation.
That's great. So if someone comes in with a pain or a problem, could they maybe expect to walk away without the pain or the problem?
There's certainly what we like to call one-hit wonders, where people come in and go through one treatment and feel much better.
Okay.
There's nothing wrong with doing chiropractic work just as maintenance. There's plenty of people that do very well with that. In most cases, when people come in for an initial visit, I like them to expect to maybe go through maybe 2 or 3 visits before we start venturing into that maintenance area. But we also kind of monitor progress visit by visit. So if somebody's improving greatly after a single visit, they might not need to come in right away, and they can continue to do their maintenance work on their own before they come to see me again.
And then you mentioned acupuncture. So do they receive chiropractic care or acupuncture? How does that work?
So I offer several different modalities. So the big ones that I look at are obviously the chiropractic adjusting. I do acupuncture and dry needling, which are two different modalities that are fairly similar or share similarities. I also do cupping for people, soft tissue scraping, and then, like I said, a lot of rehabilitative stretches and exercises. So none of them are mandatory. I make sure that people know the different services that I offer, and then we can discuss what services might be best for them, at least starting off. And then we have other services in the back pocket, so we can pull those out if we need to see different changes or maybe even add some things to your current treatment plan, just to ensure that we're making progress and moving in the right direction.
That's awesome. You have a lot of services to offer.
Oh, thank you.
Yeah. So the acupuncture, so they could just, if they want to just try it, can they just try acupuncture one time?
Absolutely. So there's protocols in acupuncture that are great for just overall health and wellness, helping to energize your body. Helps improve sleep. There's a laundry list of different benefits to things like acupuncture where you don't necessarily have to have a specific problem in order to try it.
Okay. And then, so say someone wants to try you out and schedule an appointment. How do they reach you?
Well, the best way to reach me is calling me directly. My phone number is 219-776-9705. That's my direct line. I basically handle everything independently. I am a small business, so I don't have staff that works with me. I work with all my patients one-on-one. So you will be calling me directly or texting me directly if you go through that line. And that's how I set up all my appointments. So even if people have questions regarding services and want to talk before setting up an appointment, that's the best way to reach me.
Great. Okay. Is there anything else you want to tell our audience? A lot of the people you're speaking to right now through my YouTube are movement athletes. They're people who are into health and wellness.
Absolutely. So I myself am very big into movement, fitness, health, and wellness. So that's a great demographic, but it's also not the only demographic that I handle. So whether you're an elite athlete or have a more sedentary lifestyle because of work or hobbies or what have you, no one is off the table there. So you're very welcome to contact me regardless of what your demographic is, and ideally I can help with your health and wellness.
Awesome.
As we need.
Great, thanks. All
Well,
right,
thank
awesome,
you.
Dr. Grant. Okay, so guys, Dr. Grant, I personally see him. I do practice in this location in Abstract. I have a massage room, and then I do my fitness training here. But I've also brought my son, Victor. So those of you who follow me on social media, we have a 7-year-old. I brought my son here also, and just observing as a witness, Dr. Grant is very professional and comfortable around children. So I highly suggest, even if you're looking for some other issues, if your child has like asthma or allergies, things like that, chiropractic care helps with that. So again, it's Elaine Bintz, fitness coach, nutritionist, massage therapist at Energy and Wellness with Dr. Grant at Abstract. I look forward to seeing you guys soon. Have a great day. Bye.